class. My name is Sine, and the topic that I was given to cover is operant conditioning and operant behavior. Skinnerian conditioning or instructional conditioning is what we know as operant conditioning. It is a learning method that uses rewards and or punishment to modify a behavior. Skinner theorized that behavior is changed less by the stimuli that precedes it and more so by the immediate consequence. Thus, he formulated the three-term contingency SRS, better known as stimulus response stimulus. By analyzing the antecedent stimulus and the consequence or consequences that immediately follow are what explain behavior. Human behavior is important for understanding because behaviors play key roles in survival, long and short-term health, and emotional and physical well-being. Behavior consequences are organized by reinforcers and punishers, both negative and positive. The terms negative and positive reinforcement and or punishment does not mean good or bad. Instead, it means adding or removing a stimuli in the environment in order to modify the behavior that is being targeted for that modification. An example for positive reinforcement is a child makes their bed every day and earns dessert after dinner. This is positive reinforcement because the desired behavior, making the bed, is being reinforced by giving dessert. Negative reinforcement is allowing a child to stay up late on the weekend because they were on time to school every day during the week. This is an example of negative reinforcement because something unpleasant, going to bedtime early, is removed in order to encourage timeliness at school. A positive punishment example is placing a child into timeout when they throw a tantrum. This is an example of positive punishment because something is being added to the mix, timeout, to discourage a bad behavior, throwing a tantrum. Negative punishment is a child does not clean up Legos when they're done playing, even though the expectation was that they would clean up the Legos when they were done, so the mother takes away the Legos for the rest of the day. This is negative punishment because a pleasant reinforcer, the Legos, are being removed in order to discourage the behavior of not cleaning up. In a clinical setting, the behaviors that are targeted for modification are behaviors that are considered socially important. These behaviors can include verbal disruption, aggression, property destruction, uncooperative, disrobing, or self-injurious behavior. These behaviors are found primarily in the ASD community, where ABA, Applied Behavior Intervention Plans, BIPs, that are clearly detailed the antecedents to the behavior as well as the consequences to reinforce the behavior. In the clinical setting, behaviors are defined by the maintenance of them, which are access to tangibles, attention, escape, and autosensory. Knowing how to identify and collect data on target behaviors, BIPs are able to then be implemented to reinforce change in order to aid the patient to meet the behavior reduction goal. Knowing this information is important because it allows for informed information to be relayed on to parents, caregivers, families, etc. when it comes through with following on reducing the behavior in a consistent way. When the expectation for behavior is changed in multiple environments, it allows for generalization of that modified behavior. As an RBT and BCBA, in order to modify a behavior such as disrobing, the BIP might implement a DRO in which every X amount of minutes a child checks in and earns a preferred reinforcer to promote the behavior of staying robed, even in high emotional or stimulating environments.